Recently, jurisdictions across the National Capital Region, including Fairfax County, participated in a public health emergency exercise called Capital Fortitude. The purpose? To simulate how the region would respond in the event of an act of bioterrorism involving anthrax. It was the largest exercise our health department has ever participated in, involving months of planning, dozens of agencies, and hundreds of staff and volunteers. Exercises like this one, and smaller ones that occur every year, are part of the new world of public health preparedness and response. Local health departments like ours must be ready to handle many different types of emergencies that threaten the health and safety of individuals, families, and communities. Work that requires constant planning, training, and coordination. I'm John Silcox with the Fairfax County Health Department, and with me today to talk about this topic is Fairfax County's Director of Health, Dr. Gloria Addo-Ayensu, and our Public Health Emergency Management Coordinator, Jesse Hayburn. Dr. Gloria, Jesse, thanks for being with us.
Thank you.
Thank you.
And let's start with you, Dr. Gloria, and a very basic question, which is, what exactly is public health?
So, in a nutshell, public health is what we do together as a society to create the conditions in which everyone can be healthy. And as the definition implies, it is a shared responsibility that spans across a wide spectrum of sectors and organizations that have to come together to create these conditions. And why that is important is because when we're talking about health, we're not just referring to the absence or presence of disease, but rather the state of complete physical, mental, spiritual, economic, and social well-being. And so, as you know, Department for over 15 years increasingly engages with non-health sectors so that we can really align our efforts to create those conditions.
So how did public health get involved in emergency response?
So preventing epidemics and the spread of disease is a very basic public health function. So we've always engaged in that. However, since 2001, with the anthrax crisis and the events of 9/11, public health was kind of thrust from the periphery, so to speak, of the emergency management arena, thrust straight into the center with a spotlight that has been shown on us, and the recognition of us as being a first responder that must be prepared to address a wide range of emergencies. And so, in 2001, what really brought us into this arena was as I said, the anthrax crisis. We were one of two health departments across the nation that had to open up dispensing sites to provide life-saving antibiotics to Merrifield postal workers and their downstream partners who may have been exposed to anthrax spores through the mail system.
So we know that a lot of this work started with the events of 9/11. Jesse, what does public health emergency response look like today?
Well, public health emergency management has really evolved in the 18 years since the attacks of 9/11 and the anthrax attacks that followed a few weeks after. Really evolved to be more of an all-hazards emergency preparedness approach. And what that means is that as a health department, as a county government, and as a community, we are charged with preparing to respond to all types of emergencies, not just infectious diseases any longer.
So you talk about all hazards planning and response being very important. Does that mean we still respond to things like disease outbreaks?
We do. Disease outbreaks continue to be an incredible focus of ours. When you look at something like pandemic influenza, or another naturally occurring outbreak, or something intentional like the 2001 anthrax attacks, there's a great deal of preparedness that is needed, and the health department has to respond through various ways. One of the common ways we would respond is by opening up medication dispensing sites like Dr. Gloria mentioned the health department did in 2001. And these are going to be sites that are open in locations familiar to you in your community, and that are designed to really efficiently and quickly get medication to our community, so they won't look like your standard healthcare experience.
And we saw an example of that during the Capital Fortitude exercise, where we opened a medication dispensing site as part of that exercise, correct?
That's right. Yeah, we opened one in a high school here in Fairfax County, and we're able to exercise all of the various strategies we use within a point of dispensing to get medication to our residents quickly.
So you talk a lot about what we do in terms of the planning and our approach to different emergencies and incidents. What kind of community support do you need in order to have an effective emergency response?
Well, I think Dr. Gloria would agree with me that public health can prepare as much as we possibly can, and we do. But our community members are really the foundation of our emergency response. I think it's important to understand that public health's response will vary based on the disease that we're dealing with. If we are looking at something like a pandemic influenza, for example, that happens when there is a new strain of flu, and that means there won't be a vaccine immediately available. So it will take some time for the scientific community to develop a safe and effective vaccine, and then for local public health agencies to receive that and to dispense it to our community. On the other hand, you have something like what happened in 2001, where we are responding to anthrax, and we have only days, few short days, to get medication to everyone in our community. So, we see all these scenarios. We could be faced with any number of types of responses. But in any of those types of emergencies, I think what we need from our community to support these types of responses boils down to three things. We need their attention, their patience, and we need them to look after themselves and those around them.
So let's look at that a little bit closer and break that down a bit. So you talked about needing attention from the community. Can you explain that a little bit more?
Sure. So when something like happens, we've talked already about how the scenario may be quite different and we may have different strategies
Yes.
to dispense. And so we are going to be providing instructions and information as quickly as we can to the public through any means we have to distribute that information. The news or social media, alert systems in the community, our community leaders. And so we're going to make every effort to get that information out, accurate information, as quickly as we can. But then we really need our community to listen to that and to follow the instructions, because that's really going to give you the next steps that you need to know how to respond and where to go to receive medication or other services that you may need.
It's sort of like that doctor-patient relationship, right, Dr. Gloria? You provide the patient with the instructions, and you hope and expect that they'll follow through and do what you've asked them to do.
That's correct. And again, that's why it's incumbent on us to engage with our community ahead of time. It's important to make the plans, but we also have to communicate that there will be instructions that will and that we will need them to actually follow very closely. The plans have, they're based on assumptions, assumptions that the community is going to behave a certain way. And that will be, and so if that assumption does not come to fruition, then it could result in delays in reaching everyone, which is why, as Jesse has stated, one of the most important things, if something were to happen, would be for our community to listen to our instructions and follow them very closely.
Right. And probably important to point out too that some of these things are very evolving events that can change over time, and so sometimes the guidance and instructions can change as we learn more about what the situation is and what we need people to do.
Absolutely.
So it's really important that they continue to pay attention throughout. The second thing you mentioned was patience. I want to know if you can talk a little bit more about what you mean by that.
Sure. I mean, a few things, I guess. When, Fairfax County has a tremendous emergency preparedness program, but despite all that planning and all those resources, our community will still be facing an emergency that's going to be challenging to all of us, to the responders and to the community. And I think patience is just critical on all sides when we as a community are dealing with something like that. And just in our world, in the public health world, looking at a dispensing site like we've discussed, these are locations that may be crowded, they may be noisy, there could be lines, and they are designed as efficiently as possible and as safely as possible, but in a challenging and potentially frightening situation, people's emotions, understandably, will be kind of at odds. So, we have law enforcement at these dispensing sites to make sure everything's safe and secure. We have our public health professionals there to make sure you are receiving the appropriate medication, and that our residents who need medical needs or have language needs or other types of support needs are going to be able to receive the services that they need. But all those things take some time, and in an already potentially frightening circumstance, I think patience is critical for everyone to be able to get through something like that.
And
if I may add,
yes, please.
To the patients, it's because we know that we will have enough to serve everyone. Everyone will be served, but we can't serve everyone at the same time, which is why we'll be asking constantly for patients, for people who haven't been served, to recognize that it'll get to their turn.
Right. And it is disaster medicine, right? It's not business as usual in these situations. So walking in is not like walking into a clinic like you might for a regular doctor's appointment, right? It's a whole different scenario,
It's
and
quite
so
different,
you kind of have to reorient to the surroundings. What then could residents do in Fairfax County to assist you in that by helping to protect themselves and supporting those around them?
Would you like to start, or should I?
Why don't you start, and I can.
So I think we've covered some of it already. Listening to our instructions is going to be incredibly important, because that is how we are going to let you know what you need to do. And a good example of why that would be important, just really quickly before we go on with this answer, is looking at some of the differences in how we may dispense. If it's something like a pandemic influenza where we need to provide vaccines, we need to see every single person so that we can give them the vaccine. But if it's something like in response to anthrax or many other types of infectious diseases that are treated with antibiotics, we can dispense those antibiotic pills to one member of your household, so that your entire household doesn't have to come with you to a site like this. And so that's the kind of information that we'll be providing to the public at the time of the emergency. And knowing that could really save you some time and save you some difficulties in getting there to get that life-saving medication. So listening to our instructions that are going to come out from the health department and from other government officials through the media and other sources is very, very important. I would also add that it's critical to keep yourself and your family as health safe. And a couple of points on that front, I strongly recommend, the health department strongly recommends that you stay vaccinated. You get all your vaccines for you and your family members, including the annual flu shot. And we'll be moving into the flu season here soon. Flu or vaccinations are the most important step in preventing disease. And I think covering your cough in public, washing your hands after you've coughed or sneezed, or after you have touched public surfaces and all kinds of other times will be very important as well.
and then staying home when sick. I mean, these are messages that we've, you know, shared time and time again. It kind of sounds so basic, but it's everything. It saves lives, really. And so we just can't encourage our community to do that enough. We don't have to wait for something bad to be announced in the media to do that every day. These are actions that we want people to take every day to keep themselves, their families, and our entire community safe.
So great advice. And also for the folks out there who might be interested in how can I get involved in some of these preparedness activities, maybe to help serve my community. What are some opportunities that you can speak to?
Well, I think that kind of goes to that third point about looking after yourself and supporting those around you. And there's thankfully a great many ways to do that in Fairfax County. First, I would say get involved in your community, and the health department happens to have a wonderful way to do that in our Fairfax Medical Reserve Corps program, which is a volunteer program of medical professionals and non-medical professionals. Anyone in our community can join and receive training and support us in public health emergencies and respond right alongside public health professionals and first responders throughout the Fairfax County government. There are also a number of other Citizen Corps volunteer programs in Fairfax County that are excellent opportunities. I also suggest signing up for Fairfax Alerts, which is a great way of receiving important information in Fairfax County about upcoming potential severe weather and other things that you should be aware of. And finally, I'll mention Ready Fairfax, which is a program of the Fairfax County's Office of Emergency Management that will walk individuals and families through the process of some of the most basic steps to prepare for emergencies, like building an emergency kit, making a family plan, and things like that. So signing up for Fairfax Alerts, you can go to fairfaxcounty.gov/alerts. And Ready Fairfax is available at fairfaxcounty.gov/emergency/Ready Fairfax. And I'll save what I think is the best for last. Go to join the Medical Reserve Corps at fairfaxcounty.gov/health.
All right, well, thank you. Thank you, Dr. Gloria and Jesse, for being with us and participating in this interesting and important conversation. If you want to know more about emergency preparedness activities and resources at the Fairfax County Health Department, including information about the Medical Reserve Corps, please visit fairfaxcounty.gov/health/emergency. And we also encourage you to follow the Health Department on Facebook and Twitter, and sign up for Fairfax Alerts to receive important weather, safety, and preparedness information by email, phone, and text. You can sign up at fairfaxcounty.gov/alerts. And thank you for joining us. Have a great day.